right? It doesn't really matter what type of provider you are. You could be a nurse, you could be a dentist, you could be a cardiologist, but no matter what patient conditions you're managing, it tends to always include a element of lifestyle medicine. Like, okay, move more, eat a little bit healthier, quit smoking, right? If it's your lungs that are the problem, the chronic disease of the day, if it's your heart, if it's your diabetes, right? Like no matter what's going on, this is always relevant. And the training we receive in medical school and in residency, we get into some motivational interviewing and a little bit around the basics of these, but then it's really where it kind of falls short and where I think a lot of providers feel ill-equipped to handle some of these more nuanced conversations with patients.
Yeah, I definitely agree with that. So you touched on so many different things. It's interesting that you mentioned all different providers, whether you're a social worker, physician, dentist, there's a place to implement lifestyle medicine. And that's why I think it's so fantastic. And that's why I like that definition, meaning it's environmental, clinical, behavioral, and motivational. All these different fields can sort of come together with lifestyle medicine strategies. And you mentioned the motivational interviewing. I love that. I was first introduced to that way back in undergrad, and I think it's a skill that you need to develop. And it's an art actually. It's a conversational art, and it takes a lot of being able to connect and communicate with your patient in that clinic space. I think they have the opportunity now to implement some of that motivational interviewing where they can ask questions to understand patient barriers or celebrate wins. I feel like you never celebrate wins in the regular clinical setting, right? It's all patients really do come to you for answers, and you're on a pedestal, you're trustworthy care providers, and so they want to feel seen and heard and validated. And all that takes is a couple of sentences, right? All you have to do is, oh, fantastic. I see that you're drinking more water. That's awesome. I believe in you, right? And it sounds silly when I'm saying it like this, but when you're in that vulnerable clinical encounter, you will be surprised of how a few words can actually have a long lasting impact. And then a little bit of encouragement, and then they're held accountable at home by themselves with the tool, with their friends, if their friends and spouse and family are also engaging in the platform. So a little does go a long way, both for the patient and then you feel good as a provider as well that you actually made a change, right? Versus, okay, the same diabetic person came back in and nothing changed and I prescribed the same meds and rewrote their prescriptions. Like it's just you're on an autopilot, right? So
Oh,
yeah.
exactly. You got to kind of look for those opportunities to celebrate the wins too, right? Because this is huge in terms of the motivation and enthusiasm for the patient between now and your next visit, right? Like so often, right? It just, okay, patients gained 8 pounds. They're a little down on themselves, but it's okay. Well, that was the last couple months. Now we got to start focusing on, okay, well, how did you do with some of the sub goals, the mini goals? How did you do with X, Y, or Z component of that? And making sure that you're like, again, trying to foster excitement over, okay, it has been going well in some domains. Maybe the primary thing we were looking at and evaluating went the wrong way, but how do we keep you motivated for the long term? And it's just critical to that sustainability over not just what happened this month, but the next
Yeah.
year, the next decade.
Yeah. No, I completely agree. And the approach to lifestyle medicine care is that coach approach where you're helping the patient help themselves, but it's a strength-based perspective, right? Can you believe that 1 in 3 Americans have difficulty identifying their strengths? So if I ask you, Jordan, like, what are some of your strengths? You might struggle. I personally struggle, right? But I can rattle off the strengths I see in you. I'm like, wow, you're super tech savvy, you're entrepreneurial, and I can rattle all these off. But when it comes to identifying the strengths within ourselves, we might say, I'm not gonna lie, I'm really good at hosting podcasts, or I'm not gonna like, it's always like like you're feeling like you're boasting about yourself, or you dim your own light, which I think is an unhealthy space to be in. So we need to learn to embrace ourselves. Yeah, I gained 8 pounds, but over the holidays, I was such a fantastic host to all my family and friends. They love me. They love the joy that I bring. That's a positive. And now let's focus on how we can use that strength of connecting and apply it to a health goal. Maybe you need to join a walking club every Sunday morning with other moms because you like connecting with other people. So the goal isn't about exercise and about losing weight. It's about things that bring you joy, that get you eating healthier, get you moving more, get you to reduce your stress.